In this module, we will explore the technical considerations for conducting a telemedicine visit. We will identify best practices for eye contact and camera position, and we will cover the impact of quality and position of lighting on telemedicine visits. There are technical considerations when conducting a telemedicine visit. Conferencing applications should have the appropriate verification, confidentiality, security parameters, and bandwidth to provide sufficient video resolution and audio. Compliance with privacy, security, and HIPAA are essential. Organizations must ensure the physical security of telemedicine equipment and electronic security of data. The location you select for the telemedicine encounter should be considered an examination room, which meets the requirements for privacy, comfort, and a properly placed camera for clear visibility. Here are several best practices for technical and privacy. Make sure it is only you and the patient that is in view of the camera. Don't place political, religious, or even sports items in the background. Keep the room well lit so the camera can capture you and the patient. The webcam should be placed above the computer screen, not below or to the side. Don't sit too far or too close to the camera. Your torso and up should be visible. Wear solid colors, not stripes or other patterns. Following the same American Telemedicine Association core guidelines, practitioners are to test their connection and software. Research has shown that a noticeable difference can be seen between 128 kilobits per second and 384 kilobits, but plateaus thereafter. The quality of the broadband that is used is impacted by what resources a facility has in its local vicinity to provide the best services to remote populations. In some cases, it may be appropriate to provide the patient with needed software and/or hardware for the most reliable and accessible method of connectivity. Adaptable software that accommodates changing bandwidth environments without losing connection is very helpful. Make sure to ask the patient for a callback number in cases where you might be disrupted by a poor connection. Maintaining the integrity of protected health information, or PHI, is essential. If an intermediary or third-party entity is engaged for the collection, storage, transmission, or processing of PHI, a contract should be executed as stipulated under HIPAA. These may take the form of a Business Associate Agreement, or BAA. Professionals should inform their patients about how best to protect privacy. This includes conversations around which services, if any, are being recorded and how the information is stored. Also, how privacy will be protected. Providers should know how to disable their mobile devices remotely, and organizations may consider guidelines for periodic purging or deletion of certain types of data collected during transmissions. Unauthorized use of healthcare records is one of the most common HIPAA violations. There are numerous instances where healthcare employees have removed unencrypted devices from healthcare facilities, such as phones, only for them to be stolen from vehicles or homes. Private room setups are ideal and should be picked for their convenience of location and security and privacy assurances. Sites shall be appropriately designed with audio and visual privacy for confidentiality. Originating sites shall have the ability to accommodate posture and movement. You should also have the ability to view written or drawn materials. You should have a dedicated room with authorized clearance. Prior to beginning the consultation, all parties should be identified. Make sure the standard is the same if the patient is being seen from their home. The patient may want to close their door or relocate, if possible, to a quiet, private room. Ask who else is in the room and if you have the patient's permission to speak about their health in front of this person. And lastly, ask, do I have permission to conduct this visit using telemedicine? Document the patient's response and proceed only with permission to do so. Let's quickly review the importance of eye contact. This is a major way to create a sense of inclusion. It directly impacts the patient's sense of dignity and holds the power to establish a positive rapport. As in an in-person interaction, eye contact is important to the clinical encounter. Eye contact allows the patient to feel that the provider is caring and engaged in the interaction. If the provider appears bored, or if you are multitasking, it sends the message to the patient that they are not important, or the provider would rather be somewhere else. The focal point should be the camera and not the screen that the provider is working on. Consider the camera the eyes of the patient. The patient should feel that you are focusing and caring for them during the visit. Make sure to adjust your camera and screen accordingly. This is aside from the clinical aspects of making an accurate diagnosis. It is worthwhile to emphasize that when speaking about camera positioning, that eye contact etiquette varies. Familiarizing yourself with the patient's culture will lead to protocols and treatment decisions in alignment with their culture, community, values, resources, and also in their comfort in using technology. Cultural humility is always advised. This is especially important in achieving the necessary competency in cultural attitudes, values, traditions, and behavior which are customary to an underserved or underrepresented population. Cultural humility can facilitate your interactions with underrepresented patients and by delivering high-quality healthcare, especially if they are apprehensive with technology. In conducting assessments, it is good to be familiar with trends in human behavior and to be culturally competent. Here are a few customs to consider: the perception and meaning of family, age, lifestyle factors, and male and female roles in a culture. The value of medical treatment, health education, and preventive health services is not the same across cultures and demographics. Lastly, there may be a strong influence of religion or other beliefs on how your patient responds to their disease and to their treatment. Eye contact changes with age. As a reminder, it increases between the ages of 4 and 9, it decreases right before teenage years, and then increases thereafter. Now let's turn to cameras. High-resolution cameras produce a sharper image, which makes it easier to see and follow eye gaze. Sharper images are less tiring to view and have an impact on the clinician when doing long periods of remote service. The look directed to the observer is done through what we call a gaze angle, which is the angle between the near participant's camera and where the near participant looks at the on-screen far participant. This cone of gaze defines when a person perceives you are making eye contact with them. Locating your camera above the face helps to accurately estimate a natural gaze and helps the patient feel you are looking directly at them. Good rules to remember: avoid placing a camera facing a doorway, facing a window, directly facing a light source, or placing a camera too close to yourself. Consider a passport view, head and top of shoulders. Avoid being any closer than this, or the interaction may become uncomfortable for the patient. Quality audio is essential to capturing the nuances of conversation that are vital in making appropriate diagnoses. Quiet rooms allow for intelligible transmission of speech. Furnishings such as carpet or other soft furniture have sound-absorbing characteristics. It is important to have a test run to avoid echoes that distort the clinician's voice. Microphone type and placement are also extremely important. If you do not have a flat surface available, an omnidirectional microphone can be hung from the center of the ceiling. Here are a few examples of high-quality desktop microphones. You may also opt for a headset with a microphone. This is a common practice to keep your hands free and the microphone away from the clicking of the keyboard. Adequate lighting is a necessary element for all synchronous telemedicine encounters. Ambient or fill light, which is light that fills the entire environment, is best. Ambient or fill light usually comes from large fixtures such as ceiling or wall mounts. On the screen, this is an example of an inexpensive ring-style light that can be set up on the floor or on a desktop. It comes with multiple settings, and the light can be made brighter or less bright depending on the needs of the environment. Lamps can be placed in front of the subject but behind the camera. Use diffuse lighting to avoid shining in others' eyes and reducing eye contact. Multiple light sources from different angles reduces shadow effects and glare. As an example, the main source should be located as close as possible behind the camera. For practices who are doing image capture, such as those in dermatology, there are image capture standards which should be considered. For a proper image capture, the internet connection should exceed 400 kilobits per second. It is helpful to run connection speed tests to determine the connectivity. It is appropriate to use a dermatoscope for image capture. However, if using a camera with or without a dermatoscope attachment, it should be at least 8 megapixels. Generously use rulers or other markers adjacent to the problem area for a reference point. The background should be solid and non-reflective. This can be achieved through fluorescent daylight or full-spectrum bulbs. Before you begin your patient encounter, this is a simple checklist that will ensure success. Test your webcam, check your sound, test your microphone, plug into power. Ethernet is best, Wi-Fi is second best, and cellular phone is a last resort. Close all other programs on your computer. Dress appropriately in professional attire. Have a quiet room with no distractions. And make sure to read the patient's chief complaint and other pertinent information. Once you have initiated the encounter, here are a few tips for a successful visit with the patient. Ensure that the patient can properly view you and hear you, and make sure that you have the patient's record available. Make sure everyone is introduced, and apply the same clinical guidelines for your visit as you would in person. Make eye contact and stay engaged. Ask, "Can you see me? Can you hear me? What is your phone number in case we are disconnected? Do you have a translator, if a translator is needed?" When you are about to end the visit, explain the next steps. You should follow up with your primary care physician next Thursday. I will send Dr. Jones a summary of our visit, so her office may be contacting you. Thank the patient for the telemedicine visit. Document your encounter. Then send a summary to the patient's physician if this is applicable. There are certain pieces of documentation you must secure before starting a telemedicine encounter. One of these is informed consent. In general, informed consent should accomplish the following: tell patients how their privacy and security will be protected. Tell them of any potential threats. Tell them when services may be terminated and referrals made to in-person care. And if applicable, tell them their billing arrangements, such as you will receive one bill from the hospital, one bill from your physician, and one bill from your specialist. You may be wondering what types of conditions are good candidates for telemedicine. Here are several cases to consider: upper respiratory infections, allergies, behavioral health, rashes and minor abrasions, reviewing labs or images, and following up with established patients. In summary, we have reviewed the technical considerations for conducting a telemedicine visit, along with the importance of eye contact, camera angles, and general office setup. Here are questions for review. In terms of light, what are the recommended best practices? Name 2 best practices for privacy considerations. Where should you place your camera for achieving the best eye contact with your patients? In this presentation, what ways were suggested to develop cultural competency?